Very pleasant good evening to the honorable dignitaries of the DPH and the delegates from various disciplines. So again, without any further delay, so my time is also limited. So only I will take 15 minutes. With that, I will complete my session. The session which is given to me is strategies for resilient nursing workforce in public health. So resilience. So again, resilience is a very important strategy which all the health professionals, so which we are, everybody is listening here. Resilience is the important aspect each individual should possess irrespective of various disciplines. So here next 15 minutes we are going to complete all those things. Few terminologies, introduction about resilience, importance of resilience, resilience training initiatives, strategies for sustainable staffing, nurse leader strategies to build resilience, positive impacts of resilience, and finally we'll conclude it. So we'll know what is resilience. So resilience is adapting to the situations, especially through mental, emotional and behavioral flexibility and adjustment to external and internal demands. Daily we are facing, we need to go through that, we need to accept all those challenges. And nursing workforce. So it is, I'm talking about nursing workforce, but here it is applicable to all the workforce, all the medical workforce here. So registered nurses, licensed practical or vocational nurses, and advanced practice registered nurses who provide patient care, manage health and promote wellness, and including nursing assistants and healthcare support workers who assist in patient care under the guidance of licensed nurses. Public health. So public health, of course, we all know it is concerned with protecting the health of entire population. That's what we are striving for. So health systems can only function with the help of the health workers. So based on the availability, accessibility, acceptability and quality, all these should possess our health services. And WHO estimates projected shortfall of 11 million health workers by 2030, especially in low and lower middle income countries. So we all face difficulties in education, all countries. Education, employment, deployment, retention and performance of their workforce. We cannot deny this. And this healthcare industry operates in all the backbone of its workforce. We need health workers at the backbone of the healthcare industry. Of course, everybody faced a lot of challenges during the COVID-19. So we face global challenges and labor shortages. So which we need resilience. We need to build resilience to cope with challenges and also to face the crisis and to deliver the consistent and high quality care. So what is the importance of resilience and adaptive healthcare staff? We need to, when we have workforce only, we can able to adapt to change, maintain our emotional and physical well-being during stress, because we keep on undergoing stress because we are all the health professionals. Health professionals are the only professional will be keep on undergoing stress by continuous doing the double shift, triple shift, all the shift we are doing. And then and provide top-notch care even during the most demanding times, especially during the disasters. And it is not a desirable quality. Resilience is not a desirable quality. It is a necessity for all the professionals. So it benefits the individual health workers as well as the health care organizations. When we have resilience, which will improve our retention rates and minimizes disruptions in the patient care. So recently we are hearing that young medical professionals, young nursing professionals are committing suicide because of lack of resilience. So that is the need of the hour. We need to build resilience among the healthcare professionals and also during crisis. So this resilience individual who is resilient should possess all these qualities: coping, optimism, self-efficacy, sense of humor, control, competence, hope and spirituality. So resilience training initiatives, before we start the training initiatives, we need to assess where they are lacking. So that is, which include your long hours of working, emotional exhaustion and the strain of providing care in high stress environments, especially during pandemic and disaster situations. And to tackle these issues, all the healthcare organizations, they have to target the training programs so that they can staffs will get empowered so that they can manage the stress and develop the emotional intelligence and adapt to the changing circumstances. So effective training initiatives, which include stress management workshops, leadership development programs, cross-training opportunities, and crisis simulation drills. So that we need to organize, and long-term strategies for sustainable staffing, because we are keep on having the labor shortages, especially in the public health. Flexible scheduling should be given for them, and then investing in the workforce well-being, like we need to conduct mental health programs and continuous counseling to be given for the people. And then strengthening the recruitment pipelines, like we need to have partner with the educational institutions, and then fostering a culture of support and recognition. And leveraging the healthcare staffing agencies. We need to have collaborating with the specialized healthcare staffing agencies so that during the shortages, so even in our nursing colleges, we will be provided, during pandemic, we have supplied lot of nursing workforce to handle the situations. And this is the building resilient strategies. First of all, there should be a perception and strategy which we need to understand. First of all, we need to perceive, like we need to aware of ourselves, valuing, and then we need to assuring, so where we are lacking. Finally, we need to identify, and then we need to introspect ourselves, and we need to concretizing where we are lacking, and we need to develop resilience so that we can manage all the challenges what we are facing. So if you see the individual, there are three strategies, individual focus strategies, which include resilience training. So far what we have seen, self-care practice which we are lacking. So we never practice the self-care. That of course it is important strategy we need to face. And then professional development. So previous speaker also explained about the professional development of all the strategies, and we need to build the capacity, and then mentorship in all the areas. And then organizational focus strategies, not only individual, organization should support the individual, like supportive work environment, whatever they need, the welfare measures that the organization should provide. And leadership and resources should be provided to the employees, and infrastructure and systems should be operational, and administrative infrastructure should be given to the employees. Recognition and appreciation again, which is lacking among the employees, so that they lose their resilience. So which is again an important strategy, recognition and appreciation and professional growth. So we need to keep on updating our knowledge in all the aspects. And system level strategies like collaborating with multidisciplinary organizations, flexibility in work arrangements, not rigid and always in the workspace, and emergency preparedness. We need to undergo mock drill, and we need to face so much of effort the DPH and the government organization have taken to handle the emergency situations. And these are all the work, this is the model which we need to understand. So in the workplace, we'll be undergoing the stressors, team stressors, environmental stressors, and resources sometimes will be inadequate. And in the context, we'll be facing lot of risk factors, protective factors also sometimes will be lacking, and familial or cultural supports sometimes may be lacking, and workplace support also will be lacking. So we should develop intellectual assets, physical ability to face the challenges, emotional maturity and emotional quotient should be there, behavioral ability, spiritual assets, and positive, so that we'll have the positive adaptation. And these are all the simple steps or tips to relieve the stress. Recognize when you are feeling stress, people will not they will not understand whether they are undergoing the stress or not. And then they have to practice the self-care, and they have to cultivate the kindness and recognition. So these are healthy, resilient professionals should be having all these characters. Personal character, they should have whatever problem they are facing, they should bounce back. And again, they have to come back. And then adaptability should be there. Optimism, all the characteristics they should possess. And workspace characteristics like a strong management support should be there. And then team culture we should develop, and a secure base, and then buffering capacity, coming back, bouncing back. And social network is a important strategy where we'll enhance our resilient capacity. And then we are also facing the challenges, more workload, especially in the public health system, time pressure, lack of communication, information, information overload, and then challenging patients, and then rural environment. So nurse leader strategies for encouraging the resilience. We need to practice the resilience strategies, emphasizing the professional development. We should be the example for the employees and recognizing the signs of low resilience in nurses, serving as a mentors. Everybody should have a mentors so that they'll be bouncing back. And then positive impacts, if you see, increasing. If we have resilience, definitely we will be increasing the employee retention, improving the patient care, providing the stress management, promoting the teamwork, fostering the moral resilience, supporting nurses' mental health. And here we need to develop the resilience. Resilience is not a trait, it is a practice, so that it will protect our mental health, but also empowering ourselves to provide exceptional care with sustained passion and energy. So we need to embrace the journey of developing resilience in nursing and transform coping into thriving. So thank you for your patient listening. Thank you so much for this wonderful opportunity.
Thank you, ma'am. Thank you for the insightful session.